Hello and welcome to the Eye, your English news bulletin. I'm Esther. These are the headlines. The novel coronavirus which struck the world last year has seen a number of mutations taking the experts by surprise. Now a new study has revealed that a woman with advanced HIV carried the virus for 216 days. A man armed with a knife killed 6 people and wounded 14 others in a city in eastern China, state media reported on Sunday. The US government said Saturday it would stop secretly obtaining reporters' phone and email records during investigations into political leaks, ending a practice that was often criticized as undermining press freedom. Now for the news in details. The US government said Saturday it would stop secretly obtaining reporters' phone and email records during investigations into political leaks, ending a practice that was often criticized as undermining press freedom.
The New York Times this week reported that under Donald Trump administration and continuing under President Joe Biden, the Justice Department fought a covert legal battle to access email logs of 4 of its reporters in a hunt for leaked sources. The Department of Justice said in a statement that in a charge to its long-standing practice, it will not seek compulsory legal process in leak investigations to obtain source information from members of the news media. It added that it had completed a review to determine all instances in which the department had pending compulsory requests from reporters in leak investigations. All reporters involved have now been notified, it stated. White House Press Secretary Jen Psaki said the issuing of subpoenas for the records of reporters in leak investigations is not consistent with the president's policy direction. Among other media outlets, CNN reported last month that the Trump administration had secretly sought and obtained phone and email records of one of its correspondents.
India reported 114,460 new COVID-19 cases, 189,232 discharges and 2,677 deaths in the last 24 hours, informed the Union Health Ministry on Sunday. This is the lowest number of cases reported in the last 2 months. On April 5th, 96,982 cases were reported. The following day, 1,15,736 new cases were reported. A total of 2,88,09,339 positive cases have been reported so far, including 2,69,84,781 recoveries and 14,77,799 active cases. As many as 36,47,46,522 samples have been tested in the country up to June 5th, including 20,36,311 samples tested on Saturday, the Indian Council of Medical Research informed. The national recovery rate has increased to 93.67%. The weekly positivity rate, meanwhile, stands at 6.54%. And as many as 23,13,22,417 doses of the COVID-19 vaccine have been administered so far. A man armed with a knife killed 6 people and wounded 14 others in a city in eastern China, state media reported on Sunday. The attack occurred Saturday afternoon in the streets of Anqing, Anhui Province, 430 kilometers west of Shanghai, state television CCTV said. The suspect was arrested and an investigation was underway to determine the circumstances of the attack that unfolded in a pedestrian shopping street, Anqing Public Security Bureau said in a statement released on the Weibo social network. Quoting the bureau, CCTV said the suspect was 25 years old, unemployed and angry. The authorities had earlier reported 5 dead. A badly injured victim died in hospital on Saturday, CCTV said. Knife attacks are not uncommon in China, which heavily restricts access to firearms. The Mon Battalion of the Assam Rifles organized a program on June 6 to distribute wheelchairs to differently abled villagers of Xiangha Mokok village in Mon district. The event was aimed to reach out to persons who have physical disability and people who do not have access to medical treatment and can't afford wheelchairs, updates dated. The initiative was welcomed by villagers who expressed gratitude to the Assam Rifles. They stated that it ensured the uplift of the differently able and their inclusion as part of the mainstream society. The occasion was graced by the presence of all the villagers. As part of COVID-19 awareness, the security forces personnel also distributed masks in the village, update stated. The second and final round of the first dose vaccination drive was carried out for all eligible beneficiaries 18 years and above on June 6 within Zonoboto district in all villages and sectors. The medical workers under the district's chief medical officer were divided into groups and spread across the district so as to ensure none of the eligible beneficiaries are left unvaccinated, update stated. The beneficiaries availed free vaccination by producing ID proof such as PAN card, EPIC, Aadhaar card or driving license, etc., update stated. Pom Day, which started on June 6, 1952 to shun headhunting and any form of violence in the Pom community, it was celebrated on June 6 at Longling by the Pom People's Council and leaders of Pom civil societies.
Pom Day is commemorated as a day of peace and reconciliation. Shami Ang, president of the PPC, elaborated on the significance of Pom Day and reminded the leaders of the community to be dedicated and sincere like the founding fathers of the event. He called upon the citizens to not be selfish but to work hard sincerely for the greater good of all. He lauded the Nagaland State Cabinet led by Chief Minister Nipurio and the Medical Department and the District Task Force for smoothly handling the crisis of COVID-19 pandemic. He urged citizens to cooperate with the SOPs and also get vaccinated in time. Prayers were led by N. Tialamba Pom, Executive Secretary of the Pom Baptist Christian Association, and Tanlie Pom, Pastor at Muli Baptist Church.
The oxygen expresses have delivered more than 26,281 metric ton of liquid medical oxygen in more than 1,534 tankers to various states across the country, the Railways Ministry informed on Sunday. As per a statement, 6 loaded oxygen expresses on run with more than 483 MT of LMO in 26 tankers. Southern states of Tamil Nadu and Karnataka received more than 3,000 MT of LMO each from oxygen expresses. Meanwhile, oxygen expresses offloaded more than 2,800 MT of LMO in Andhra Pradesh. Oxygen expresses started their deliveries 43 days back on April 24th in Maharashtra with a load of 126 MT. Oxygen relief by oxygen expresses reached out to 15 states, namely Uttarakhand, Karnataka, Maharashtra, Madhya Pradesh, Andhra Pradesh, Rajasthan, Tamil Nadu, Haryana, Telangana, Punjab, Kerala, Delhi, Uttar Pradesh, Jharkhand and Assam. Till now, oxygen expresses offloaded LMO in around 39 cities and towns in 15 states across the country. Railways is picking up oxygen from places like Hapa, Baroda, Mundra in the west and Rourkela, Durgapur, Tatanagar, Angul in the east and then delivering it to several states. The novel coronavirus which struck the world last year has seen a number of mutations, taking the experts by surprise. Now, a new study has revealed that a woman with advanced HIV carried the virus for 216 days. Now, a new study has revealed an unsettling case of COVID-related mutation. Turns out, a woman with HIV carried the virus for 216 days. During this time, the virus mutated at least 30 times, a study awaiting review has revealed. Published on Thursday, the report referred to an unnamed woman from South Africa. The 36-year-old woman reportedly had COVID for over half a year and was host to numerous mutations, including 13 in the spike protein, which is responsible for the virus evading one's immune response. In addition, 19 other mutations were recorded according to the study. The study sheds light on how erratic coronavirus could become in hosts that have other long-term ailments which diminish the immune system's ability to fight the virus. While most people effectively clear SARS-CoV-2, there are several reports of prolonged infection in immunosuppressed individuals, the study stated. The study represented a case of prolonged infection of greater than 6 months with shedding of high titer SARS CoV-2 in an individual with advanced HIV and antiretroviral treatment failure, it stated. Further, it stated that thorough whole genome sequencing at multiple time points, the study demonstrates the early emergence of the E48-4K substitution associated with escape from neutralizing antibodies, followed by other escape mutations, and the N501Y substitution found in most variants of concern, the study noted. The death toll from the worst militant attack in Burkina Faso in recent years has risen to 132, the government said on Saturday, after armed assailants laid siege overnight to a village in the jihadist-plagued northeast. The attackers struck during the night on Friday, killing residents of the village of Solhan in Yangha province bordering Niger. They also burned homes and the market, the government said in a statement. It declared a 72-hour period of national mourning, describing the attackers as terrorists, although no group has claimed responsibility. Another 40 residents were wounded, government spokesperson Useni Tambora later told reporters. The United Nations said Secretary General Antonio Guterres was outraged by the attack, whose victims included 7 children. Despite the presence of thousands of UN peacekeepers, attacks by jihadists linked to Al-Qaeda and Islamic State in West Africa's Sahel region have risen sharply since the start of the year, particularly in Burkina Faso, Mali and Niger, with civilians bearing the brunt. The violence in Burkina Faso has displaced more than 1.14 million people in just over 2 years, while the poor, arid country is hosting some 20,000 refugees from neighboring Mali. Finance ministers from wealthy G7 nations on Saturday endorsed a global minimum corporate tax rate of at least 15%, rallying behind a US-backed plan targeting tech giants and other multinationals accused of not paying enough. U.S. Treasury Secretary Janet Yellen hailed the unprecedented commitment, saying in a statement that a global minimum tax would end the race to the bottom in corporate taxation. Facebook even got behind the move despite the social media giant facing the prospect of having to pay more tax, while non-governmental organizations said it did not go far enough. Following the 2-day gathering in London, the G7 said in a final communique that it will commit to a global minimum tax of at least 15% on a country-by-country basis. The G7, comprising Britain, Canada, France, Germany, Italy, Japan, and the United States, said it hoped to reach a final tax agreement at the July gathering of the expanded G20 Finance Ministers Group. Nagaland's Department of Health and Family Welfare will be observing World Food Safety Day on the June 7th with the theme Safe Food Now for a Healthy Tomorrow. Aims to stress that production and consumption of safe food has immediate and long-term benefits for people, the planet and the economy, the department stated in a press release.
Recognizing the systematic connections between the health of people, animals, plants, and the environment and the economy will help in meeting the needs of the future, the department said in its statement. According to the department, food safety is a pertinent issue that has a significant impact on public health. It is estimated that every year, the department stated, 100 million cases of foodborne disease are reported in India, and it costs $15 billion annually to the country and is expected to rise up to 170 million people per year in 2030, increasing 1 out of 12 to 1 out of 9 people falling sick on an average. These foodborne ailments not only pose a threat to the health of the public but also affect the socio-economic development of the country, the health department stated. The Food Safety Division of the state implements the Food Safety and Standard Act 2006 through the Enforcement and Analytical Wing, the department stated. Implementation of enforcement activities is done at the 3 zone levels for the state by a designated officer assisted by food safety officers, and analytical activities is executed at the state public health laboratories or state food laboratory, headed by the food analyst assisted by technical staffs, the department stated.
The Serum Institute of India has received a preliminary permission from the country's drug top regulator to make test batches of Russia's Sputnik V vaccine, the Indian Express has learned.
If cleared, the Pune headquartered vaccine maker may be able to add one more COVID-19 vaccine to its portfolio. The company on Friday received Drug Controller General of India Dr. V.J. Sumania's permission to manufacture batches of Sputnik V for test and analysis. A source close to the development told the Indian Express on condition of anonymity. It is likely that the SII will be able to use this permission to make test batches of Sputnik V to ensure that it is the same as the Russian vaccine that has received the DCGI's restricted use permission. In doing so, the batches may also be tested by the regulator for aspects like quality and stability. The batches produced with this permission cannot be used for commercial purposes, the source said. Another source said that it is expected that the SII would take a few months before it would be able to begin commercial production of Sputnik V. It is unclear how many doses of the vaccine SII plans to manufacture on a monthly basis, as no agreement between the Pune company and the Russian Direct Investment Fund on Dr. Reddy's laboratories has been announced. Queries sent to SII and RDIF on Thursday about how many doses of Sputnik V are expected to be manufactured as per the agreement remained unanswered at the time of going to press on Friday.
That's all for tonight's English News Bulletin. I'm Esther. Keep watching Hornbill TV.